Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call, and today we head to California. Dr. Mark Ghaly, the Secretary of Health and Human Services, talks to Dr. Josh Sharfstein about the state's new COVID strategy. Let's listen.
Dr. Mark Ghaly, thank you so much for joining me on Public Health on Call. How are you doing today?
I'm great, Josh. It's great to be with you. Thanks for having me.
So I read recently that California has a new plan for COVID-19, a plan to consider this disease a manageable risk, not an emergency. Can you tell me a little bit more about what you have in mind?
Yeah, Josh, 2 years in, we've learned so much about COVID, about our capability to respond, about the difficulties we have as communities and states managing what has been just a really difficult emergency. And for California, we call the plan California Smarter. Smarter is an acronym. I'll spend a few minutes on that. But really, it's a recognition that California's best strategy moving forward is to be really prepared for whatever this virus throws our way, and to really communicate clearly to our communities that we will be prepared and we're not moving on, but we're moving forward.
So California has a reputation for being one of the states that has responded most aggressively to the pandemic from the beginning.
Some might call it aggressive. I would call it based on the science and the level of uncertainty, with the primary focus of protecting Californians and saving lives. And this just isn't about health. This is about making sure people feel safe and secure to participate in community events, culture, and commerce.
So throughout 2020, 2021, there are different policies you put into place based on the science, as you say, that did save a lot of lives, and California has done very well compared to other places, for example, in this country. What led you to come up with a new approach heading into 2022?
Really, we needed a different approach, right? We started with this being a novel coronavirus, and keyword novel. We didn't know it. It didn't know us. People who were exposed had unprecedented levels of illness. And really the suffering and trauma from it was extreme. And as we move into the third year dealing with COVID, we know a lot more. We know how to use the tools in the toolkit. We're hoping not to use them all the time, but we know how to use them in more precise ways, what metrics matter. And then we have to recognize that many Californians, many Americans now have immunity. Different levels. We're not sure how strong it will be for months and months to come. Still a lot to learn. But we have this concept in California early called get to immunity. We really shifted that to keep up our immunity. And so those two things really require us to have a different approach than what we had 2 years ago.
So tell me about the new approach. What does it look like? What's different about it for people in California?
Well, I think what is most different is we're not just focused on transmission or epidemiologic metrics. We're really focused on response metrics. We're telling Californians, look, when it comes to masking, California is going to have a stockpile of masks that are going to be available whenever we need them for our public to be protected. Same thing for testing, same thing for hospital surge. We're going to set up expectations that if we see a signal in our wastewater surveillance system across the state that says, look, COVID's starting to circulate again, we're committed to, within a certain period of time, 30 to 45 days, Is this a variant that we know already, or is it a new one? If it's a new one, immediately start working with the CDC to sequence it, understand if our vaccines work, if our medications work, and if our tests work, and be able to communicate clearly with Californians what all that information means so that they can keep themselves and their communities safe.
So it sounds like, on the one hand, you're saying some of the mitigation measures that we've used may not be needed right now, but on the other hand, it's a plan for a pretty high level of vigilance.
It's absolutely a plan around vigilance. It's a plan around being humble in the face of a sneaky virus that shapeshifts all the time, and having the tools in California and across California. I'll remind you, especially for those listeners on the East Coast, we can fit 22 other states in California's borders and our population. All the way from Massachusetts to Maryland doesn't quite reach the span of California. So we need to be ready in a way that other nations have to plan. And so we continue to lean on some of our own broad surveillance systems and making sure Californians can come to rely on our preparedness as a key tool to reduce the level of fear we have to have in the face of COVID moving forward.
So during this period when cases are coming down, hospitalizations are coming down, what's going to be the status, do you think, of mask wearing in California, or say testing in California?
Yeah, California has done an incredible amount of testing over the course of the pandemic. During the height of Omicron, we were doing over 600,000 tests in a day, and that was largely PCR tests, not even the antigen tests. So heavy emphasis on testing, and we're going to continue to use testing as a key tool, both surveillance testing, but also testing in some key places like some of the high-risk workplaces. We expect that some schools will continue their strong testing programs moving forward, and that's going to help us track the twists and turns with COVID moving forward. When it comes to masking, I mean, we've laid out pretty clearly expectations statewide around masking. We have 58 counties in California. Some decide to be a little bit more strict than the state requirements. And we've always said that's wonderful. That's great for local conditions to drive what people do. So I think largely California is starting to see mask requirements indoors lifted, except in some high-risk places. And but yet some counties who want to stay a little bit more health protective are going to keep it in place for a few more weeks, is what I anticipate.
Now, earlier you sort of dangled the idea that SMART is actually an acronym. Is that true? Can you walk us through that? Smarter.
Yes,
okay.
Smarter, and SMARTER stands for the S stands for shots and vaccines, and the importance of us continuing to work on getting Californians vaccinated. We have a very good vaccination rate, but we have work to do. Boosters for older Californians are not high enough, especially when you look at it through an equity lens. And equity is an anchor to the entire SMARTER concept, that we know we need to be there for communities that have been disproportionately impacted, that often get overlooked through the traditional healthcare services lens. And so with shots, it's really focused on getting communities that are a little behind caught up. M stands for masking, commitment to having 70 million high quality masks, respirators, KN95s available to Californians when we need them. The A stands for awareness, and that really comes down to our surveillance systems and our ability to coordinate and watch when signals of disease are starting to increase. The R is about readiness, and this spans everything from our hospitals being ready to bring in staff when we need to improving indoor air quality and ventilation. Huge focus on ventilation, and have a few exciting things there, like one of the nation's first indoor air quality task force being launched, a whole innovation award around low-cost improvements to indoor ventilation that we hope California's scientists and engineers are going to dig into. The T stands for testing. and our ability to keep our testing infrastructure very high in California. The E is for education and how we're going to continue to work with our K through 12, but childcare centers as well to make sure they continue to be safe and able to function in person by using the various tools available to us to keep that going. And then R finally is around RX for treatments. And I think California sometimes gets labeled as a state that just leans into mitigation strategies and vaccines, but we've been a state that embraced treatment from the beginning. We set up many public monoclonal infusion sites. We worked to get our fair share of all the medications into our state. And now it's about innovating to make sure that those treatments are available in an equitable way. Test to treat modalities and opportunities really leading the way for that in California, and we hope a model for the nation.
So it sounds like what you are charting with this smarter approach is a path that's in between trying to do everything possible still to reduce the number of cases every day and sort of putting it all in the rearview mirror. It's an approach to be essentially try to manage this reasonably, lower the risk, but not necessarily try to eliminate it. Would that be fair?
Yeah, I think we know that it's going to be impossible with this type of virus that mutates for a living, that rears its head at different times of the year. Will we find some seasonality? I told Californians clearly in the past couple of weeks, like, we're going to be ready late summer, early fall, when we've seen each of the last 2 years increase in cases. We're going to be extra ready around between Thanksgiving and New Year's when we've seen the highest rise in cases. So there's going to be some predictability around this, that we're going to keep our guard up higher, but always ready for anything that comes about. But as I said, we're not out of the woods, but we don't need to live in fear for what's behind the next tree.
As you're finding that path through the woods without too much fear, how do you handle people's anxiety in both directions? And one of the things we've talked about on the podcast is that people are looking for a middle ground in a way. But the question is, when you find that middle ground, half the people think that it is too lenient and half the people think it's too strict and nobody's happy. Like, how do you build some consensus around the California path right now?
Yeah, I think what we've always said is we're going to keep in our forefront the health of Californians, and it's going to be led by the data and science. And we haven't wavered from that. And that's still at the heart of this approach. I think what we hope we'll be able to do more effectively is communicate what we're seeing in very transparent ways. Give our population the simple sense of how to use the tools. We also are creating, as part of the California Smarter Plan, a smarter COVID ABCs document, single page. What do Californians need to know about masks, vaccines, testing, therapeutics? What's the current guidance around isolation or quarantine? All on a single page, so it's not confusing. We've given Californians hundreds of pages of guidance to sift through, and they just want the one-liner. So how do we translate the data and science into the one line that is communicated consistently and simply, so people know what to expect? And we hope by using that, we'll find the folks who tend to want to be on that path with us and keep them there moving forward. We know it's not going to work with everyone. And part of the Smarter Plan, Josh, is also about managing the mis and disinformation and continuing to combat that with thoughtful messages, consistent messages that are based in the science. And that we hope, if we continue to put that out there consistently, we'll start to beat some of that back a little bit, because that has been certainly, and I'm sure you've talked about that on the podcast many times, one of the biggest challenges we face.
Yeah, so you have the dual challenge of creating a path for California and helping people see that path amidst all of the confusion out there.
And therein lies, Josh, public health.
Indeed. I think that's absolutely true. So I want to maybe take a step back and say, how long have you been the Secretary of Health and Human Services in California?
Governor Newsom's first appointed Health and Human Services Secretary, coming very close to 3 full years in the role.
3 full years. You had about a year before the pandemic, and then 2 years the pandemic. And you and I have known each other a little bit over the years. I'm just curious how you look back on this time so far. Is it disappointing that you wound up in this position and suddenly it was all about the pandemic for quite a long time? Or did that turn out to be, a little bit of an opportunity?
Well, first off, I took this job to serve Californians. And I can't think of a more important and better time to live out that mission effectively. I came into the role hoping to serve the most vulnerable with a real focus on equity and erasing historic inequities. And COVID has allowed us to focus on some of that more than we would have otherwise been able to. I call COVID the great unmasker of inequities and the great accelerant for change. And I think California has changed so much in the last couple of years. The opportunities to transform bread and butter healthcare delivery systems is real, and one we've taken an opportunity to look to do. The opportunity to infuse systems with resources that for so long haven't had those resources, to reimagine certain parts of our both health and human services system, to integrate them differently, have all been things that, whether it's been part of the COVID response or a result of the COVID response, I've really found a great privilege to be a part of, with an amazing team of people doing it here every single day.
Well, I'm very glad to hear that California has really made some really important progress during and in spite of, and in some cases because of the pandemic response, like you're talking about. How about yourself? We've been asking some of the health officials that we've had on the podcast, how you have maintained the level of energy and commitment through this incredibly difficult time, now all the way to the point of having a vision, one of the nation's first, for what the new normal looks like. How do you motivate yourself?
As a fellow physician, I'm sure you can relate to this. It's about the patients. And California, in this case, is full of 40 million people that I see as a true privilege to get to serve. And even though it's hard and we're making unprecedented decisions with no playbook or blueprint, it is something that is quite an honor to have a chance to be a part of. So that is the motivation. I have an amazing family, 4 young kids, a wife who's also a physician leader doing some of the same work in Los Angeles, and the chance to be able to have their support and the focus on people of California allows me to get up, not always with the same level of energy every day, but generally speaking, trying to bring it for California so that we do our best.
Well, Dr. Galli, thanks for all you're doing. Thanks so much for joining me on Public Health on Call.
Josh, really a pleasure to be with you today.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.